Good morning, good evening, greetings and salutations. Let's keep the momentum moving and work through a critical near miss on the ward. Grab a beverage, get hydrated, and let's get started. Your cognitive load and fluids. You got to balance both of them, and that's just two of many other things. So let's go back to that same shift we talked about earlier, the one with heart failure patient, diabetic on fluids, and a person with pneumonia needing antibiotics. I want you to imagine that we have paused the ward like a movie. You're standing there, you've got your drug trolley, fluid balance chart, you've got a clipboard of obs, and there's the regular on the ward buzzing in your head that just doesn't stop. Now, we're going to take a highlighter and mark every separate thing your brain is being asked to manage about fluids alone. Not the whole job, just fluid related tasks. When we do this, you'll see, let's see, what gets written in the handover. IV fluids, Q4 obs, manage IO. Well, that's going to be quite a bit of work for you. Can be dealing with IVs. You've got observations every 4 hours, and you got to check out and keep up with the ins and outs. Now, let's go and start with the fluids itself. You have to recognize which bag you are hanging. Is it normal saline? Is it Hartmann's, dextrose, a colloid, something with potassium, something with glucose? No one expects you as a first year to recite the exact electrolyte content of every bag, but they do expect you to at least hang the right one. Now, after hanging it, there's the rate. You need to read the order correctly. You've got to set the pump, double check it, start the infusion, and remember when it will finish so you can plan to change it. On top of that, you're also meant to know whether that rate and that type of fluid makes sense for the patient's heart, kidneys, blood pressure. Is a liter over 8 hours gentle or aggressive for a frail elderly man with a stiff left ventricle and creatinine twice the normal range? That's not written on the pump, and your brain has to make that connection. Remember, in the previous discussion, the notes said gentle fluids. How are you to ever know what gentle means given the context of the patient? Now let's layer in the chart. Oop, looks like an early trip to the toilet for someone. Okay, now layer in the chart. Every sip, every collection of urine, every vomit, every drain, every bag of fluid, every bolus. The chart expects you to record amounts, times, not impressions. You can't leave it at just an impression. It wants totals for each shift. It wants those 24 hours. It wants to bring those totals to handover in a way that makes sense, not just numbers that are being thrown at whoever's going to be carrying on. Now, while you're doing all of this, the ward is asking you to answer bells, comfort families, prepare medications, check blood sugar, take observations, weights, respond to changes in patient conditions, and it's not unusual that in a 12-hour shift, you have 10, 20 different small fluid-related entries that need to be made for 3 or 4 patients. If even one of these is delayed, forgotten, where does that leave you? Uh, if you can't remember it, what do you do? You've got to get the story on the chart as accurate as possible. This is where the hidden cognitive load of fluids comes in. And it's not just about knowing the difference between crystalloids, colloids, oral fluids. We will get to that. It's about your brain being used as a live calculator, a pattern detector, and a storyteller that's under constant conditions of fatigue, hunger, interruption. When you reflect on errors in fluid documentation or missed early signs, hold this picture in your mind. You're not a robot that glitched. You just have a working memory, attention, and judgment that are being pulled in 10 directions at once. Now, there are three big questions that the ward expects you to answer every time you touch a fluid order, a pump or chart. Okay, so fluid order, pump, chart. First question, what kind of fluid is this? and where will it go into the body? That's your differentiation. Is this fluid going to stay mainly in the blood vessels, spread into the space between the cells, or mostly support oral intake and gut function? Is it a clear bag that looks harmless but carries a lot of sodium, or a bag that carries glucose that will affect someone's metabolic balance? Even if you cannot yet describe the exact compartments in anatomical terms, your brain is being asked to make the call. Is this the right tool for this person's current state? Let's go to the second question. What are this patient's heart, blood pressure, and kidneys doing with this fluid? That's your integration. The same liter of fluid dropped into a fit 20-year-old with diarrhea will behave very differently compared to a 75-year-old with heart failure and chronic kidney disease. The blood pressure response, the heart's ability to cope, the kidney's ability to clear the volume, and the risk of fluid backing up into the lungs all change depending on those underlying conditions. When you read an order that says 1 liter of normal saline over 8 hours, the paper doesn't change the color to say, warning, 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 red, red, red. It doesn't tell you that the person's heart and kidneys are in trouble. Your mind has to overlay the order with the picture you have of that person's cardiovascular and renal function. The third question, does this fluid balance chart tell a coherent story over time? That's your narrative. The numbers you write are not just filling boxes, they're actually paragraphs in this patient's story about how much fluid is going in, how much has come out, and how well the body is coping. If there are holes in the chart, if totals are missing, if weights are not recorded, the story has plot gaps. No one wants that. Experienced nurses can often read charts like novels. They can tell you the full story, learn from them, and have them as your very best mentors. They will see the buildup of positive balance, the day a patient suddenly starts passing less urine, the night shift where nothing was recorded. As a student, you're learning to see that story, but you're often doing it without anyone explicitly telling you that this is what the chart is for. You are told, fill it in. This is what you have to do. What you're learning is by filling it in, this is the organ level story being written. Now, I want to come back to the pressure dynamics we've alluded to, as well as you in your work and in your habits. Think about a long day where you skipped any proper food, you drank almost no water, you ran on caffeine, your brain is starting to fuzz out. You forget small things more easily, you skim things instead of reading them fully. You just don't see them making sense as they enter in your head. You tell yourself that you'll come back to a task later, and sometimes you don't even do that. That's because, not for lack of intent, you're under pressure, your nutrition is down, your rest hierarchies are upside down. Your body and your brain are trying to survive the shift. So imagine that if you're going through all of these problems on shift as a healthy nurse, what's your patient feeling? Can you imagine how the fluids and nutrition are affecting them? So when we ask you, be accurate and timely with fluid. Notice every early sign of overload or deficit, integrate all of that into a heart and kidney function story. You're being asked to be the superhuman nurse that you're meant to be. Backwriting and guesswork don't quite do it. I know you've got to sometimes say, okay, I'm going to fill it in when it's a little bit less hazardous, when it's a little bit less busy. Um, Great intentions. We'll see how well that balances and how much you want to stick with that once you learn how filling it in right at the time is the best thing you could ever do. Now, if we don't talk about it, it just doesn't get named. So there it is. This overload in the system is affecting how well you keep records, how well you actually pay attention to the health and well-being of your patient. Doesn't mean that the risks are going to disappear just because you're really good at writing in the chart. The heart failure patient's lungs don't care whether you fill in the chart or not. They're going to do what they do. But filling in that chart is going to help assess problems as they arise. The kidneys of the diabetic who's been on fluids for days didn't care that you had three patients on only two hands. The circulation in this diabetic patient is going to respond to volume the same way, whether or not you enter a value or not. But caring for them in the best possible way does depend on how you do with your charting and your assessment of those volumes. That's why we have to have both things happening at once. Fluids are very high risk coming up from that often understated, simplistic value of learning. Now, our job in this module is going to reduce your cognitive load by giving you clear patterns and questions so you're not trying to reinvent fluid physiology from scratch while someone is yelling for a pan. Let's make this more concrete with the heart failure patient. On the shift that we brought into our discussion, you were unconsciously trying to answer the three questions. You recognized that the bag was saline. Everyone treats it as that very basic of all. Well, we're going to see you're no longer going to do that, right? You might have remembered that your patient had heart failure and kidney issues at the time you were looking at the bag. Did you feel confident enough to question the order if it was required? If the doctor was rushed and gave you the order, would you question it or know that it was the one that had to be done? This is what starts coming into perspective. Looked at the chart. You saw bits of it filled in. You told yourself you'll add your totals later. Now, even as you're thinking that, the ward is asking you to do something else. You've got to have the fluid, you need the rate, you half remembered what the bloods were. The last set of observations, the swelling you noticed, better write that down. What is the state of this chart? Someone else is now calling and you need to help them. It's a lot going on. What I want you to hear is that confusion and missed connections are evidence that no one has really broken this down into the manageable mental steps yet of your early beginnings. You're getting there. You've been given fragments and pieces. Now you get the experience and get it all into place. Lectures on types of fluids, separate lecture on heart failure, tutorial on documentation, a placement where they ask you to keep an eye on fluids. You've got to now synthesize all of those very disparate elements and put them together into what it's like on the ward. You've got to stitch it all together, and you are under fire. It's overwhelming. So let's deliberately join those things together and start to build those patterns and systems for you. Let's look at what kind of actions happen in the body because of the kinds of fluids. We're going to also look at the early signs of overload and deficit, how they appear, and what they look like. We'll show you how to read a chart as a story and how to link that to blood pressure, heart sounds, and kidney function. By the end of the module, you're going to still feel very stretched in your role, but you'll also see a liter of fluid ordered for a frail patient, and your brain will say, what is this person's heart and kidney capacity right now for this order? It will mean that when you are writing on a chart and you know which numbers matter, you will put down the numbers that are going to pass on the information that keep that patient safe. It'll mean that you can walk into a room, glance at the IV pole, the patient, the chart, form a first reasonable impression of whether the fluid story makes sense. So coming up, let's step back one more time, talk directly about your body, your learning, your overwhelm. We're going to connect fluids to your own experiences of dizziness, thirst, swelling, exhaustion, and we're going to reframe your relationship with the topic of fluids. Let's leave it at this point by saying, I don't completely get fluids, but I can absolutely learn this, and I know why it matters.